Hi, my name is Caitlin, and I chose to do my project over the documentary about the opioid epidemic that was found on Netflix called The Pharmacist. During this presentation, we'll be discussing the why behind this documentary, explaining the opioid epidemic. We'll also look at how this epidemic relates to our current healthcare system, and then we'll also talk about the outcome of those who were involved in this particular documentary and kind of how everything ended up playing out for all of those involved. So The Pharmacist is about a father who worked as a pharmacist. During that time, he had lost his son due to the opioid epidemic. He lived in New Orleans, and this particular event took place in the Ninth Ward there. After the loss of his son, Dan Schneider began conducting his own investigation into what led to the death of his son. During this investigation, he was able to find who murdered his son, but not only that, he was also able to discover a doctor who was overprescribing OxyContin. He also pushed to have more monitoring and accountability, not only for the doctors who were prescribing the medications, but also for Purdue Pharmacy, who manufactured and promoted the drugs. So what is the opioid epidemic? This occurred from 1999 to 2019. During this time, there was around 500,000 deaths due to overdose of the prescription and illicit opioids like OxyContin. It came in about two waves, at least during this specific epidemic. The first wave occurred in 1999. The second wave occurred in 2010. That one was more leaning towards heroin. So during his investigation, Schneider contacted the police office, their local news station, and questioned people on the streets to find the murder of his son, Danny. During this time, he ran into a lot of trouble with getting answers. Police officers didn't seem like they really wanted to help or were not being as helpful as he wanted them to be. So he took it on himself and essentially went door to door asking people if they had seen anything and just trying to find a solution or trying to find answers to what had happened to his son. He ended up using the phone book to contact neighbors within a certain radius of the murder scene to find someone who may have seen what had happened. Originally, the wrong person was actually accused for the murder, and then come to find out, they were able to find them based off of one of the phone calls that Mr. Schneider had made to a woman who witnessed the murder and was able to identify not only who it was, but that that person was the one who originally had accused somebody else. After finding the murderer of his son, Schneider knew that there was still more that needed to be done. During that time, Purdue Pharmacy had marketed OxyContin as a magical drug that would solve everybody's pain and gave them a sense of their normal life back. Schneider began to encourage patients to avoid filling their prescriptions at the pharmacy where he worked. This actually worked against him because his boss, the owner of the pharmacy, felt that this was not going to solve anything. It was only going to prevent him from getting the business that he needed. He actually ended up tracking a doctor and found that she was running a clinic in the middle of the night where she was overprescribing medications like OxyContin, Soma, and Xanax, which at the time were known as the Holy Trinity because of the effect that these medications combined would have with one another. This doctor was named Dr. Jacqueline Cleggett. So then when it comes to holding them accountable, Dr. Cleggett was investigated by the DEA and did end up losing her license to practice medicine. Her clinic was raided where they were able to find pre-signed prescription pads with her name on them, essentially that were just missing the name of the patient and the medication itself. And they also found a large amount of cash, which sent a lot of red flags to the officers. Purdue Pharmacy used sales representatives to promote OxyContin to doctors and encourage them to use them as a method for treating pain. These sales reps were given a large bonus to encourage them to essentially look the other way and to really push sales. They also marketed the drug by telling patients that they were not addicted, but they were pseudo-addicted, which basically just meant that they really were in pain, and that's why they may have come off as being addicted. Purdue Pharma was eventually sued for their involvement in promoting the use of these addictive drugs that were leading to overdoses and deaths of those using the opioids. However, the former president of Purdue Pharma did not believe that they were involved in the epidemic in any way, All of this happened while the company was profiting over $35 billion in sales since 1996. So what do we do now? Part of this documentary actually spoke to the pressure of using a medication monitoring system where providers are able to track how many times these are being prescribed, which doctors are prescribing them, if the dosage is correct, those kinds of things to be able to monitor that. It also speaks to the ethical and moral responsibility to those that hold positions in the medical field and for those who actually are not in the medical field, to hold those people accountable and to make sure they understand the effects that their actions have on their patients. In 2018, the Substance Use Disorder Prevention that Promote Opioid Recovery and Treatment, or SUPPORT Act, for patients and communities was passed. This act then provided expanding existing programs, creating new programs, research funds, telehealth, and it also provided payment options to those who needed their services. And these are my references.